Well, good afternoon, everyone. As I mentioned yesterday in our media availability, I mentioned that there would be a new face that will be joining us at the table today, and I want to welcome Mr. Bill Woolridge. He's with us, and as I said yesterday, he's someone who's recovered from COVID-19, and we're very pleased today that Bill has agreed to share his story, and I'm sure many of you will be interested in hearing what Bill has to say in his own words, as Bill and his wife lived in their home through Bill's COVID-19 experience. So before we get to that, however, I want to turn it over to Dr. Fitzgerald for our update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media briefing yesterday, we have no new positive cases in the province. The total number of cases remains at 256. By region, we have 238 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% male. By age, we have 22 people under the age of 20, 37 people between 20 and 39, 37 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 5 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 205 people have now recovered. In total, we have tested 6,902 people. We are closely monitoring the progression of COVID-19 in our province, and another day with no new cases is good news. It certainly gives us hope and encouragement that better days of normalcy are coming, even if this means a new way of life for now. As I mentioned yesterday, we are currently considering how to relax some of the public health measures in place, but we know that this will have to be done methodically with careful deliberation and thought. This cannot be rushed and must be done with the utmost health and safety of all of us in mind. Based on the total number of cases and the number of people who have recovered from the virus, we know that COVID-19 is still active in our province and can still very easily spread. Our common goal right now must be to avoid sporadic cases from becoming clusters and clusters from becoming widespread outbreaks. That is why it is so important to continue to adhere to the public health measures in place. Please stay home as much as possible, especially if you feel unwell. Maintain physical distance of at least 2 arms lengths away from others. Practice proper cough and sneeze etiquette, and wash your hands for at least 20 seconds each time, or as long as it takes you to sing happy birthday twice. Our actions today will dictate our situation going forward. We must continue to act together to reduce our risk and that of our families, friends, and communities. To help us as we move forward, I am today issuing 2 new public health orders. Effective April 24th, 2020 at noon, all travelers arriving in Newfoundland and Labrador must complete a declaration form at their point of entry. Effective April 27th, 2020 at noon, all travelers arriving in Newfoundland and Labrador will be required to submit a 14-day self-isolation plan upon entering the province. This is a challenging time for many, as COVID brings feelings of angst and uncertainty for us all. And though we are all different and unique in our feelings, we have likely never before had more in common. Feeling stressed and anxious during a pandemic is not a sign of weakness, but a sign of being human, as we all are. If you are feeling worried and find it difficult to cope, please know that help and support is only a phone call away or a text message. Please reach out to our provincial warm line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight, to speak with a trained peer support worker who is there and ready to listen. You can also connect 24/7 with a crisis responder by texting WELLNESS, WELLNESS, to 741-741. This service is provided by Kids Help Phone, but is available to anyone in the province regardless of age. During these times of uncertainty, when our patience and resolve are in short supply, let us be reminded of the power of positivity and kindness toward one another that will help see us through to brighter days. COVID-19 is for now, but it will not be forever. As a recap, for those who may have just joined, we have no new cases since yesterday's media availability, and our total number of cases remains at 256. By health region, this brings us to 238 cases in Eastern Health, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. COVID-19 has kept us apart, but in so many ways it has actually brought us together. It has forced us to break down barriers to better support our vulnerable populations, put aside differences by working together, and to seek the best in one another. We have learned that even in times when we feel broken together, we can find ways to break through. And though we cannot forget what is now behind us, what matters most is the hope for what lies ahead. Thank you.
Thank you, Dr. Fitzgerald. No new cases again today and 2 new orders, as Dr. Fitzgerald has just mentioned. This is really about tightening up our borders and making sure that people that would enter Newfoundland and Labrador would have to actually fill out the declaration, but also to put in place a self-isolation plan for some 14 days. So we've had some success in Newfoundland and Labrador, and we also know that traveling and exposing Newfoundlanders and Labradorians to COVID-19, if we tighten up our borders and make sure that those people entering Newfoundland and Labrador would have a 14-day self-isolation plan, this will lead to further success. So this is a good sign for Newfoundland and Labrador. It means that all of you are following the guidelines. In saying that, however, we must continue to remain vigilant. So we ask you to continue your efforts in flattening the curve and the spread of COVID-19. There's still 40,000 cases across Canada. We've seen this has doubled in the last 14 days with nearly some 2,000 deaths. So we know that it's still in our country. We know that it's still in our province, and there is a lot at stake. So as we know also that one life lost is one life too many. So to date, we're reminded we have lost 3 people in Newfoundland and Labrador, and we think of them daily, and our thoughts and prayers are still with those families that have been impacted. Following guidelines is not a sign of weakness. In fact, I see it as a sign of wisdom. It's a sign of understanding. So let's continue to be wise and protect our families during this health crisis. And as Dr. Fitzgerald has said, just because we haven't seen any active cases in the past few days, it doesn't mean that it isn't around us. It lives here. It may not be visible, but it lives and moves silently amongst our communities. And no one is more aware of this than the person to my right, Mr. Bill Woolrich. Bill has recently recovered from the virus, and I want to thank him for taking his time to come with us today and share with you his story on what it's like to have and to experience COVID-19, but also to talk about his recovery. Not everyone is open and comfortable in sharing a lived experience on a live broadcast to thousands of people, not just in our province, but even outside our province. So we appreciate Bill's willingness to be here with us today. Now, from my previous conversation with Bill in the last few days, I can assure you that he is here for one reason, and that is his concern for you. So I now turn it over to Bill to share his story of what it's like to be exposed to COVID-19.
Thank you very much, Premier. It's a pleasure to be here, and thanks for the opportunity to allow me to share my COVID-19 story. Good afternoon, ladies and gentlemen. My name is Bill Woolrich, and I'm happy to share my COVID-19 experience with you today. I am a statistic of COVID-19 positive in the Eastern Health Authority. Confirmation from a test done on March 24th. On March 12th, my brother-in-law, Edward Tobin, passed away. He rested at Call's funeral home on Sunday, March 15th and Monday, March 16th. He was buried from Call's funeral home on March 17th after a funeral celebration from Call's chapel. My first COVID-19 symptom occurred the evening of March 19th. I experienced a headache and some pressure on my forehead. COVID-19, though, didn't even cross my mind at the time. I am prone to sinus infections and assumed I was having the onset of an infection. Friday evening, I was not feeling well either. I was having headache and I was experiencing some fatigue. To my knowledge, a headache at that time was not considered to be a symptom of COVID-19. On Saturday morning, March 21st, we received a phone call from a family member notifying us that an individual at Carl's funeral home tested positive for COVID-19. My wife and I went into isolation, self-isolation, right away, and it was only then I wondered if I had contracted the coronavirus. On Sunday, I began to experience low-grade fever and chills. After a call to 811, a test was arranged for both my wife and I for Tuesday, March 24th. The next day, we were notified that I had tested positive and my wife negative. We were instructed to isolate for 14 days. We were also asked to separate ourselves from each other as much as possible in our home. So we practiced physical distancing, 2 meters apart in the living room, in the rec room, in the kitchen, separate bathrooms, separate bedrooms. We ate at different tables. Those measures appeared to work since my wife never contracted the coronavirus. I guess proof that physical distancing works. During my sickness, I experienced fever, chills, sweats, fatigue, cough, headache, and loss of appetite. For at least 6 consecutive days, my fever ranged between 100.5 to 101 Fahrenheit. And during the overnight, especially, I experienced chills and excessive sweating. I managed the fever as best I can with Tylenol. As my symptoms began to dissipate, I felt well in the mornings, but became very tired during the afternoon and evening with headache and low-grade fever. During the COVID-19 period, though, I did not experience aches or pains, nor did I experience any respiratory issues. My symptoms disappeared around Thursday, Friday, April 2nd, 3rd. Both my wife and I were retested on Monday, April 6th. We both tested negative. My wife had to continue isolation until April 17th. Even though she did not have any symptoms, that was in the event that she picked up the virus for me during my COVID-19 period. We are both well. I am feeling great and certainly thankful to have made it through that period. During the COVID-19 period, not only were we concerned about my well-being, but we were also concerned for family members and friends. I would say about 25 family members were diagnosed positive as a result of our gathering at Carl's funeral home. They included some of our siblings and their spouses, some of our nieces and nephews and some of their spouses, some cousins and some of their spouses. Some of our friends also visited the funeral home to pay their respects to my wife and I, 2 of which tested positive, and 1 of those were hospitalized for 5 days. It was a worry for sure, but we are happy that they've all recovered. They've turned a corner on the virus, and now they are all doing well. I'm happy to receive questions from you later this afternoon, but before I conclude, I do have a message. Coronavirus is not a hoax. Coronavirus is very real. Coronavirus can make you very sick and even threaten your life. Please respect this virus. I want to extend my deepest condolences to the families of the 3 individuals who passed away as a result of complications from coronavirus. It is so sad, and I am so very sorry. In closing, please understand the importance of physical distancing and good hand hygiene. It may save your life or the life of a loved one. Thank you.
Well, thank you, Bill, and thank you for sharing your story, and you're putting a personal touch on what it's like to be tested positive for COVID-19. But I also want to mention thank you for following the guidelines right away, and for you and your wife in self-isolation. But also I want to reach out to the people that work and answer the calls at 811 for the great job that they've been doing, supporting people like Bill and making sure they get the testing that's required, and to the public health workers, healthcare workers that we have in place and the work that they're doing. You're very early on. So Bill, thank you once again for sharing your story and providing the insights in your experience of COVID-19. And all of us are happy to hear that both you and your wife are in good health. But the message from Bill to all of us today is one that is very clear, it's very strong, that the virus is not a hoax. It is very real, and it can make you very sick, and as Bill said, can threaten your life. Bill, you painted a very clear picture for us. And he's not asking us for anything that isn't easy, and not asking us for anything that isn't important. It's just a simple reminder to follow the guidelines that's been put in place. It is not a sign of weakness. It's a sign of wisdom. It's a sign of understanding. So together, let's continue to be wise and protect our families. I now pass it over to Minister Hagee for his comments.
Thank you very much, Premier. And thank you to our guest for his account and for exhibiting the social responsibility that we have seen from the vast majority of Newfoundlanders and Labradorians. As you can see, with only 48 active cases remaining in the province, we have collectively been able to flatten the curve. And it's been a testament to both the people of this province and good public health measures and dedication from all healthcare providers, really, that we have managed to find ourselves in this fortunate plateau. But not only has public health been key here, but as Mr. Woolridge pointed out, physical distancing has been an integral part and will continue to be an integral part of any strategy in the short and medium term future. Physical distancing has been hammered home well, and a lot of businesses, essential work, has been conducted in a very responsible way with regard to physical distancing. Where physical distancing hasn't been or isn't truly feasible or attainable, Dr. Fitzgerald, on the advice of other experts as well, has recommended now the use of cloth masks or non-surgical masks to protect others. One of the unfortunate side effects for that, again, is for those people who, for communication and are hard of hearing, rely on lip reading to communicate. And so, as with all of these measures, I think there will always be occasions where we need to show a little bit of empathy and a little bit of flexibility and understanding for those people who might be very challenged in circumstances where people's mouths are covered. it can make an enormous difference, as I know from my own experiences with hard of hearing family members, that communication with your mouth covered is really quite a challenge. Similarly, with the physical distancing element, we have hammered home wherever possible the idea that you should, as a household, go once a week to get groceries, and ideally that you should simply go alone. We also acknowledge that that can be difficult as well, and I think everyone understood the situation with young children, for example, for whom there was no caregiver available while mom or dad went shopping. But we've also heard lately around the need for support people for those with medical issues or convalescents, and for those who have visual impairment. And again, while by and large the generality holds, one person, one household, one shopping cart, there are occasions where store owners do need to just bear in mind that that's not safe or practical for certain challenged sections of our community. And I would ask for people's understanding and empathy in those situations, that whilst we do make these general orders, and in this case these are recommendations as far as stores are concerned in the detail of it, that there does need to be some flexibility, and I would appreciate that, so would they. A lot of our measures have been trying to identify vulnerable groups, and we have looked at protecting seniors particularly. And I do appreciate from comments yesterday and the day before that whilst we don't have numerical staffing challenges in long-term care, those staff that are working there are doing so now, providing care to their residents without the ability to rely on support people in those environments. So the reverse, again, is problematic, and I'd just like to extend my thanks to the fact they picked up that slack and done a grand job doing it. So from the point of view of looking forward, Dr. Fitzgerald has talked about new border controls as part of this adaptation process that we're going to start and we need to go through over the next weeks and months to come to terms with the fact that a virus is now also a Newfoundlander and Labradorian. It's with us for a while and not going to go away in the short term. The border controls we have referenced. We are conscious of our links as a province with other jurisdictions, particularly for work. And as someone who spent a year and a bit doing a turnaround, I have a certain amount of sympathy with those people who would come home. And I would ask their collaboration and cooperation with these new measures, because at the end of the day, the beneficiaries will be all of us. But particularly it's done from the point of view of protecting as many Newfoundlanders and Labradorians as possible from this virus and from the experiences that Mr. Woolridge has had. So we have plans under development, and these will be rolled out. They're not secret; they're just not finished yet. And as soon as they're ready, we will bring them forward. It's going to be harder to unlock the lockdown than it was to put it in place. And I think we have to realize that it's going to be a slow process, because each change we make, we have to assess to make sure it doesn't cause problems with resurgence of the virus and outbreaks or clusters forming. Even with all that due diligence, unfortunately, we are still likely to see cases over the next 6 to 8 months, and we need to be aware of that. We need to build in a capacity to respond in the healthcare system, whilst at the same time recognizing that there are people whose care has been put on hold, which can't be held forever, needs to be moved forward, as well as people who will become sick from other non-COVID issues in the meantime. So it's going to be a balancing act going forward, and certainly it's going to be done in partnership. It's going to involve stakeholders, it's going to involve charities and community groups, it's going to involve business. It really will involve every facet of life, and while health and public health will provide lead and advice, at the end of the day, we have to make decisions on the conditions of significant uncertainty. So I think we all need to have a little bit of forbearance as well. So with that, I would just like to conclude again by congratulating Mr. Woolridge and all those Newfoundlanders and Labradorians who have held the line. We need to continue to hold the line. I've said many times before, you build a bubble of protection for yourself and your loved ones, you stay in it, and you don't go out and burst anybody else's bubble. And with that, Premier, I think I conclude and pass it back to you. Thank you very much.
Well, thank you, Minister, and thank you for the reminder and the commitment that we have made as a government and as an all-party committee to continue to work with you as we continue to make changes in the future. It is a partnership. It is all of us working together, driven by the science and the evidence that's provided to us by our Chief Medical Officer. But before I open it up for questions today, there's just a couple things that I just want to make mention for Newfoundlanders and Labradorians. And one of them is to wish our Muslim community a happy Ramadan. And this is wishing them a holy month that filled with good blessings. And we send our best wishes and hoping that you will have a rewarding Ramadan, continuing, however, to practice physical distancing. Secondly, I want to make mention of something that's taking place tomorrow. And as all of us, throughout the country, especially in Nova Scotia, aware of the shocking and the devastating mass shooting in Nova Scotia last weekend. Tomorrow, the National Police Federation is asking all Canadians, residents of Newfoundland and Labrador, to wear red. The symbol of red, as we know, is something that's symbolic to the Mounties and to the RCMP, and it's to acknowledge and mourn the loss of Constable Heidi Stevenson and the many other innocent victims of this senseless act in what is now becoming Canada's largest mass killing. So out of respect for the lives lost and those that are injured, both physically, I will say, and mentally, out of respect tomorrow, let's do something, show our support for them and wear something red. It's putting our plans in place for tomorrow. We show our support for over 20,000 RCMP members across Canada. So these are challenging times, I'm sure we all agree, and particularly exceptional for what's happening in Nova Scotia and through the RCMP family. So with that said, tomorrow, just a reminder to show our support as Newfoundlanders and Labradorians and wear something red on tomorrow. So with that said, I now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. In the essence of time for today, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask the question. Please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
These new measures that are going to be put in place on the 24th and 27th, who will be tracking these forms and following up on them?
These forms will be followed up by right now, where the process will be that someone will get the isolation forms, and they will follow up with those people. We are in the process of training the people right now to be able to do that, and if there's any concerns with compliance with the plan, then that will be referred for enforcement. If there's any concerns with development of symptoms, then obviously they will be referred to the appropriate regional health authority, public health division for follow-up.
So one of the things that we've done to strengthen up the security at the border is earlier this week, it's something that we've been working on as part of the training, as Dr. Fitzgerald has said, is to work with the staff at FLHR. They've been used to and have been doing some enforcement and those kinds of procedural things for many years now throughout Newfoundland and Labrador. So what we're looking for is consistency because, we have the airport here in St. John's, we have, Marine Atlantic, we have, points of entry into Labrador West and into Happy Valley Goose Bay, and so there's quite a few areas and points of entrance into the province. So looking for consistency to make sure that the measures that are put in place by the Chief Medical Officer, we get the compliance that we need. So we'll continue to, as we work on this plan, have it in place. We've already started at various measures right now with the RNC as well in Labrador West. So there'll be a number of people that will be involved in this, but primarily driven by, and the information will be used by public health.
Thank you. And the NDP are calling for legislation to extend sick days, emergency leave days, and worker compensation coverage through the pandemic. Premier, your response to this?
So, of course, we always, review legislation, labor standards throughout Newfoundland and Labrador. So these are things that would have to be considered and taken, finding a balance for, what's right for those that would be impacted, keeping in mind the workforce as well. So it's been a very difficult time for people in our province, and many of our workers have, felt the hardship, especially those with on low income. But we put in a number of measures to actually support those essential workers. I can, point to childcare as an example. We've worked very closely with the federal government and a number of programs, that's been reaching now in terms of the increases in HST, the increases in the new response programs, emergency response programs, been very inclusive. So right now, if we need to look at labor standards, this is something that we're always, willing to review and look at. I've had conversations with the leader of the NDP on this very issues. We all have as an all-party committee. So, these are things that you look at over time and look for measures to actually increase labor standards within our province. But during the pandemic time, we must make sure that with the guidelines that are in place, that anyone that is working would work in a safe environment.
Thank you. And we've heard extensively we're working on a plan now for lifting restrictions and looking to get back to some form of normal. We've heard that the public health emergency would be one of the last things to be lifted. Is there any indication of what could be some of the first to be lifted?
So that will take...
Kellyanne, I think one of the first things will be a priority would be the health care issues that have been in suspended animation, if you like, for the last 6 to 8 weeks. Certainly there is pressure from a clinical point of view to look at that. And the question is quite how you would do that. But within the healthcare system, I would certainly see that as one of the first points of give. The other issues then would be around diagnostic and therapeutic procedures, for example. It's a trade-off because we do need beds. They obviously would be not available if they were being used for planned procedures. And so there's going to be some resumption, but how fast and how much, I think, is going to be the issue. We're working with the RHAs, who are in turn working with the specialists about admissions. So that I would see from a healthcare perspective as being the first thing. And I think one of the lessons that we have from other jurisdictions is that when you make a change, you have to wait after that change before making another one to see what the effect of the first one is. Because if you don't, at the end of the day, if something were to go awry and you start to see a rise in cases, you need to be able to pin down what's caused that.
Thank you.
So if I could just for a second, I know there's a lot of questions from reopening, the province. And I know there's, people that want to get back and, some people still think we will go back to the way it was, in early March. But, the fact is that whatever this new normal is, we must plan for that as well, and making sure we have good border controls, on the advice of the Chief Medical Officer, things that were outlined even today, but also to make sure that we have real good inventory of PPE, as we've mentioned already as well, because, as we start to reopening things, we must also be prepared, as the Minister had just said, for those that would need to re-enter the acute care setting. And, this also reminds us of the need to actually make sure that we have the appropriate inventories around testing. So we're planning for all of that, but we must keep in mind that we must be prepared to make the necessary changes in order to respond to anything else that could flare up. We just heard a story from Bill as he told his story. The funeral home, there was 178 people that were impacted by that, and Bill's family was 25 of those. So we prepare to open things up, but we also must plan to make sure that we have procedures and measures in place before we open up and take the necessary measures that I know people will want to see throughout this province.
Our next questions are from Andrew Robinson of The Telegram. Please go ahead.
First off, following up on the 14-day self-isolation plans that people will need to submit upon entering the province, with those, will government staff be, if they deem the plan submitted to be inadequate, will government staff be directing people to make alternative plans, or will there be any, even if in cases where it may be merited, will there be any options offered that could involve any form of government assistance if need be?
So that is certainly part of the process, is to assess the plans and ensure that they are adequate, and to ensure that there's not a risk of exposure of vulnerable populations and those sorts of things. With regard to assistance, we certainly would like to enable people to have as good a plan as possible. However, the details of that are not firm at this point.
I don't think anybody should...
Andrew, if I might just chip in there as well, the ultimate goal would be rapidly to have this kind of declaration and isolation plan information available on the internet, so that people would be able to fill these forms in and have sight of all the information they would need prior to actually getting on their flight to this province, to educate them and encourage them. The majority of the people that we see coming in, the short term, particularly, would be Newfoundlanders and Labradorians who are doing some kind of turnaround. So the connections already exist. There are places for them to go, and it's a question of getting it done in advance and educating them before they land.
Yeah, there's a good point there. And just to build on what's been already said about this, no one should be surprised as you come into Newfoundland and Labrador, as you travel anywhere in this country, that it's a country and a province that's dealing with the impacts of COVID-19. As the minister has said, the numbers of airline travel are way down. And so no one should be surprised at all. All you need to do is, before you buckle up into your seat into the aircraft, is just look around. The aircrafts are full. We're seeing people wearing masks now. There's really no excuse at all for people traveling into Newfoundland and Labrador not to be prepared for a 14-day isolation plan. If measures would need to be taken to actually support them or give them direction, provide the proper direction, these are things that we need to look at. But, the messages are out there loud and clear. If you're coming to Newfoundland and Labrador, there will be stricter border controls in place. If you're coming here, have a self-isolation plan ready, and make sure that you fill out the required documentation that will be required.
Thank you. If I could ask a question of Mr. Woolridge. In speaking today, I was wondering if there was any one particular thing or instance that compelled you to speak out about your own experience of testing positive and then recovering from COVID-19.
I just thought when the Premier approached me, I jumped on board right away. I felt it was important to tell the story. I felt that it was important that the public understand that the virus is real, that we need to take precautions, that people get sick. And we've seen 3 individuals from this province pass away. So again, my message is the virus is real. Please respect this virus. Thank you.
And Mr. Woolridge, if I could, I'd like to say thank you for joining us today to share your story. I think it's important for people to see that, you can get through an infection. And I know how difficult it is to get up and share your story in front of TV cameras and the public. So I really do appreciate you for coming and telling your story and sharing our message about physical distancing. Thank you.
My pleasure. Thank you.
As a follow-up, Mr. Woolridge, how much of a challenge was it for yourself and your wife to manage the logistics of physical distancing within the household?
Yes, well, thankfully my wife was well, and she was able to prepare meals, keep the house running. For my part, I helped out a little bit when I can, when I got a little bit of energy, but from my focus, I wanted to rest as much as I can to save my energy to be able to fight this virus off. So, but it wasn't too difficult. The spacing wasn't difficult. When we watched a bit of TV, we kept, 6 feet apart. When we were in the living room having a chat, we were 6 feet apart. She prepared most of the meals. And so I think the difficulty was the isolation itself, especially from my wife's point of view, because she had been in isolation from March 21st to the 17th of April. So there was that was the difficulty of being housebound, but no, we managed through it. So thank you very much.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
We've known that travel has been one of the biggest risk factors right from day one. Why has it taken a month for us to put in these mandatory reporting and isolation measures?
So people have been quite compliant with filling out these declaration forms, and we have been able to follow up with people, and people have been compliant with the isolation period too. So, and I think the attest to that is the fact that we are in a place right now where we are seeing 0 cases for several days. So I think people have been following the rules. We did this now because we know that as we start to relax measures, we need to have a much clearer idea about importation. We need to be able to handle, to find all of those cases so that we can prevent a surge in cases that could overwhelm healthcare capacity. And as we start to relax measures and allow other procedures to happen within healthcare, we have to make sure we protect that capacity. So this was really to help us as we move forward.
Premier, your government has told municipalities they can't bring in states of emergency to prevent people from coming into their communities. There's no provincial order banning travel between communities. So why does the mayor of Wabash say he has permission from you in order to start banning people from coming into his community?
Yes, what they have permission to do is set up checkpoints and information points for people that will come into their communities. Of course, all communities are concerned. They want to see essential travel only, so it's non-essential travel. That these are the people that are trying to get information into. So we support our communities. In Labrador West are doing the very same thing. But states of emergencies within communities, there's criteria that's been in place, and municipal affairs and environment, that department who is responsible for towns and cities throughout our province has sent a letter a few weeks ago now outlining what a community state of emergency, very similar to what we would have seen with the recent weather event area on the Avalon portion. So states of emergencies for communities are very different than the public health state of emergency that we have in place. So, what they're setting up there are information checkpoints, and we encourage that. It's important to know who's coming into your communities and that it's should be for essential travel only. So that would be for people requiring, medical services. It could be people coming in to pick up things like prescription drugs or for food and so on. People is for essential traveling only, and that's what the information lines are for.
But Premier, the mayor of Labrador West has said they are in fact turning people around. It's not just information that they're handing out. They're in fact saying you are not allowed to enter our community. So, isn't that against the law? Well,
I guess that'll be dependent on who tests the law. But the fact is, I guess what they're doing is reiterating the fact that they just want to see essential travelers coming into their community. We have the Quebec police force on the border there between Fairmont and Labrador West, and we also have people that are RNC officers that are there. They've been supported too, by the way, in the past by the local fire firefighters in that area as well. So there's a lot of community activity up there. We have 0 active cases in Labrador right now. So what we're seeing are a number of communities working very hard and very diligent to make sure that we reduce the amount of non-essential travel, that it's essential travel only. So it's a strong message, seeing communities come together to try and support and do the best they can by keeping down the spread of COVID-19.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
A lot of comparisons in the past few days, comparing Newfoundland, Labrador to other provinces in terms of a plan for moving away from a lot of these restrictions. When you look at announcements made elsewhere in the country, how do you think Newfoundland, Labrador shapes up in terms of the amount of information that's being communicated?
I think from my perspective here, what we've been seeing is a very, people in our province are very engaged. I know from, speaking with communities and Newfoundlanders and Labradorians in all parts of this province right now, we're seeing a community engagement around how we're dealing with this health crisis and COVID and the impacts of COVID-19. I think our province and our communities are doing a great job. We do focus, and we have focused quite a bit on those, people that haven't been compliant. That's a small number, but it's a dangerous number if you don't follow the guidelines. So we see the impact on communities, but for the most part, I think, that Newfoundlanders and Labradorians have done a very good job. And I think that, some of the cases that we're seeing today, or the lack of cases, it really indicates the job that we've done and that the public health measures are working. So I give a big shout out to our team at Public Health. I give a big shout out to Newfoundlanders and Labradorians who've been very compliant for the most part.
Patrick, I think from the point of view of information that's shared out there, I think if you look at what we've put out, and we've done it early, and we've adapted to people's suggestions in terms of how we present a lot of the dashboard information around communities with disease and this kind of thing. I'm not sure that you could point to any jurisdiction in Canada that is doing it in a more comprehensive way than we are. They may be presenting it slightly differently, and that might be in response to their own local nuances. I mean, quite honestly, I'd flip the question around and say, what is it you think we're not telling you? And what is it you would need to know? And I think these kind of sessions every day, where it's a question period for 45 minutes with people who can answer your questions, I would turn it around and say, what is it you're missing that you feel we should tell you?
I'd like to ask a question about schools as well. Schools back in session, at least in a different sort of format. How would you grade the adjustments that have been made so far?
So I would speak to the education system, and let's keep in mind this is a system that went through a snowstorm for the most part. About at least Northeast Avalon, a snowstorm in January where we've seen schools closed for a couple of weeks. Now we reached this phase of trying to deal with the pandemic. I think schools have adjusted, very well. I know I get great feedback from teachers that are directly involved with their students, and I hear students who compliment the teachers for staying involved with them. And I know we're seeing this at the K-12 system, but we're also seeing this in the post-secondary system as well. So from an education point of view, from K-12 plus our post-secondary, I think we've seen a very good response. And I think there's a lot of lessons that people in all communities will learn from this, is how we can engage both using the technology that we have in place. The classroom is very different, and sometimes it's just not it could be from your living room and from a teacher who is sitting somewhere in their living room as well. So there's some lessons that we learned from this. I think they've been very successful so far. And as we go from the progress report on April the 22nd, I'd encourage all students, you have an opportunity to actually bump that mark up a little bit. You can improve your mark, get ready for post-secondary education, those in the grade 12 programs, and those going into the grade 12 program, you can be better prepared for September. So let's not waste this time that we have available to us from now to June. Let's make good use of our time and learn some lessons in case we have to go through this experience again.
There's a lot of people who have been working, long term from home for now for a number of weeks. Do you have any recommendations for people in terms of, trying to work in a most ergonomic way as possible, things that they can do or resources that are out there for people if they're in this situation long term, they might not have all of the setup that would be required, things that they can do?
Well, you know what? We're into an interesting spot here today because we have, I can speak for the public sector point of view, over 5,000 people now that's been set up working from home. We have, I know most of our ministers right now would be working from home. But, I don't know if I should put Bill on the spot or not because, Bill is a long-time public sector worker and who's doing a very good job in our department. And maybe Bill would like to make a comment on what it's actually like to work from home because I know Bill is actually doing a bit of that. So, Bill, not sure if you do, not to put you on the spot, but he gave us an insight on COVID-19, did a very good job, and maybe he can actually speak to the experience of working from home.
Yes, thank you, Premier. Working from home, it has its challenges, but I would have to say OCIO has done a fantastic job in providing our teams with the assets and the networks we need to work remotely. There are challenges ergonomically. I mean, for those, for staff members that are sitting at kitchen tables or dining room tables and they're typing. There are issues, and we're dealing with these on a day-by-day basis and trying to rectify them where we can. Some of the challenges also, ability to print reports and read reports. So what we find is some of the members in the department and throughout government as a whole are reading 30, 40, 50-page reports on a computer screen. So, but you must realize, when this virus came upon us, we had to act quickly. I think government did a fantastic job in allowing its workers to work remotely so quickly. So let's say we're getting the bugs out of the system now, and we're working forward to try to work with our ergonomics, work with printing and other issues, but they will be dealt with in time.
So what we're doing now, and as Bill, quite rightly, outlines here, is that we're working with our departments to take an assessment of what's happened, because this is essentially something that happened within a month. So it's been a quick response, and people like Bill have stepped up. So the due diligence for us right now, as we lead this government, is to actually do the assessment on what would be required, just in case we go back into a similar mode at some point. We're not out of this one yet, and see, what the workforce looks like in the future and how many people could potentially work from home at some point in their career. That's not what the discussion is now, but just in case we need to go back into this, do the assessment of what would be required on some of the very same things that Bill just outlines.
Operator, we have about 7 minutes left, so please do not end the call at 2:59 as we have two reporters waiting to ask questions. Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Is for Dr. Fitzgerald. I was hoping we could get a bit more information about what type of details should be in an isolation plan. Is it like a checklist they come up with, or is it like an essay?
So there will be a form that's actually has to be completed, and that form will ask the questions that we need to know about an isolation plan. So where will you be staying? Will you be around anyone with other conditions that may make or that are considered vulnerable? It would be any concerns that you might have about maintaining isolation, or is there anything that you would need to be successful at that isolation? So we want people to be able to do the right thing, and we want to be able to support them to be able to do that right thing. So ideally, we would like to have that information prior to them coming to the province. So to echo what the Minister and Premier said earlier about having this be able to be submitted prior to, but of course it will have to be presented in person as well at the point of entry.
Perfect. And, over the past month, we get daily updates on the number of people who've been hospitalized and in the ICU. And sometimes the number changes, sometimes it's the same. However, it doesn't give us an idea if these are the same people or not. So would you be able to clarify how many people in total have been hospitalized and how many have been released and gone back home?
Certainly, Elizabeth, that's a good number. We have concentrated on a daily snapshot, and I think that probably just represents our bias in terms of that's what it means to us as as managers, as operators of the healthcare system, because that's a workload indicator. I don't have that information to hand in accumulated way. There are 5 individuals hospitalized across the province today. Certainly I can get that for you. That won't be a problem.
Oh, thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Are we considering mandatory testing for those who are returning from Curl Lake, where now we know more about asymptomatic and pre-symptomatic transmission?
We're not considering mandatory testing. We are asking anyone that has been to Curl Lake to call 811, and we are testing anyone who presents with saying that they have been that they've returned from Curl Lake.
And Premier, I'm sure you noticed some of the uproar after the new restrictions on open fires were put in place yesterday. Can you just clarify these regulations for people and explain why these were necessary to implement?
Goodness, I would say that I was one of the ones that when I saw the report, I said, "Oh my goodness, this is not something that's going to go over too well." I mean, I'm like no different than many other Newfoundlanders and Labradorians. I do enjoy when I get an opportunity to sit by a campfire and at some points and sometimes even on a Saturday night listen to VOCM Cabin Party or something. So, these are things that we do, and so I think the measures that were put in place. This is really not about a ban. So if you're used to having a campfire in your backyard like you did last year, well, look, you can continue to do that. The guidelines that were put in place yesterday were these are guidelines and bans that have been put in place for almost 30 years, and I think the reaction I got some reaction yesterday as well. So we spoke with the minister. I think he's been out there publicly now. So the kinds of campfires that you had in your backyard last year, you can do those things, but this is really prohibiting and restricting large brush burning and so on, grass fires. We've already seen I think about 5 or 6 already this year at all. But listen, when you want to have your campfire in your backyard, do it, get some water there, use some common sense like you do, in the past years, and make sure that you prepare just in case you get something that should occur, just so a bit of prevention here. But so for Newfoundlanders and Labradorians, I'm on your parade. We want to make sure that you can enjoy those, quiet, campfires in your backyard, the opportunity from time to time over this summer.
And lastly, Mr. Woolridge just wanted to pass condolences to you and your family first, but I was just wondering how the family is coping after all of this and knowing that the gathering is linked to such a large cluster of cases and that it affected some 25 members of your family. How is the family coping with all that on top of everything else?
Ben, I would say to you that while we were going through this, it was very concerning. We had a couple of family members that made visits to the hospital. We had a friend that spent 5 days in hospital. We had another friend who was at home. His wife is a nurse, so he was in good hands. But through his sickness, he lost 24 pounds. So it was a trying time trying to deal with dealing with our own issues in our household, as well as being concerned about our family members. So we were glad, I will tell you, we're glad to be through this period. Everybody, family members have recovered. We are doing well. If I could just sum it up in one word, I would have to say very thankful. We're very thankful for the recovery of family members and friends. And just thankful, Ben. That's probably the best way I could put it to you. Thanks for your question.
Thank you very much, sir.
Thank you very much for tuning in, and thank you, Mr. Woolridge, for participating today. The time for questions has ended, and we will be back again tomorrow at 2 p.m., 1:30 in Labrador. Have a great evening.
Thank you. The conference has now ended. Please disconnect your lines, and thank you for your participation. Thank you.
Bye.